Cerebral aneurysm, a time bomb in the head. Prevent cerebral aneurysm with the algorithm of Talos's artificial intelligence. Meet ANRISK, Talos's AI-based cerebral aneurysm risk assessment service. Cerebral aneurysm doesn't have any pre-symptoms and has a high mortality rate when led to rupture. So it is very important to obviate risks by detecting cerebral aneurysm carefully to prevent rupture. But brain angiograms are not for all patients because they're very expensive and posing side effects. Talos uses big data of the people's health assessment results to develop its unique AI algorithm of telling who is more vulnerable to cerebral aneurysm than others. My name is Taekyun Kim, a neurosurgeon and professor at SNUBH, and a founder CEO of Talos. I'm specialized in cerebrovascular surgery, and more specifically, cerebral aneurysm surgery. Subarachnoid hemorrhage caused by ruptured cerebral aneurysm is fatal. But fatal subarachnoid hemorrhage can also be prevented by timely repairing cerebral aneurysm. Seeing patients do not survive and cannot spend more time with their beloved family despite the best treatment is very painful as a neurosurgeon. The number of cases of this painful hemorrhage can be reduced by allowing more cerebral aneurysm screened and finding out more cerebral aneurysm unruptured yet. But the problem is, we were unable to determine who is more vulnerable to cerebral aneurysm than others. That's why Talos developed ANRISK, an AI-based cerebral aneurysm risk assessment service, utilizing big data of the people's health assessment results presented by National Health Insurance Service. With ANRISK, we can now forecast one's vulnerability to cerebral aneurysm based on age, sex, and laboratory data such as blood test results. ANRISK informs you of one's vulnerability to cerebral aneurysm in quintile groups, where the highest quintile is 50 times more vulnerable to cerebral aneurysm than the lowest quintile. So if you are in the highest quintile, you are vulnerable, and you should consult your specialist for diagnosis of cerebral aneurysm by brain angiograms. ANRISK assesses cerebral aneurysm risk based on the reliable data and is expected to play a key role in managing cerebral aneurysm for those examined at medical examination centers. Using ANRISK is as simple. Register as a user, enter the examination items, and upload the data to assess how vulnerable the examinee is. When the assessed results are reported to the examinee, the medical examination center recommends that the examinee have his or her cerebral aneurysm more thoroughly inspected. As for company managements, they are always exposed to the risk of getting penalized because in Korea, they're now responsible for the injuries, like cerebral aneurysm, occurred in the line of duty. ANRISK effectively assesses the employee's vulnerability to cerebral aneurysm as a preventative measure, and the medical examination centers suggest examinations and treatment procedures specific to the examinees. My name is Jin Deok-ju, a co-founder of Talos. I was a neurosurgeon at SNUBH, currently in Jeju National University Hospital, also as a neurosurgeon. To me, ANRISK's ability to forecast one's vulnerability to cerebral aneurysm by only using the people's health assessment results is something that I am most proud of. Some of the mortality rate and the percentage of people experiencing some type of disability, even after cerebral aneurysm is treated, exceeds 60%. And the fact that this fatal condition rarely sends the pre-symptoms to the patients makes it even more life-threatening. Diagnostic radiology is not available for everyone because it is neither covered by the state-level health insurance nor affordable. The ability to forecast one's vulnerability to cerebral aneurysm effectively prevents the rupture and refers affected patients to the consultation. So, meet ANRISK, Talos's algorithm-based cerebral aneurysm risk assessment service that keeps you from one of the most fatal diseases you may contract. Algorithms protect you. Talos.